Hey, whether it's a simple lunchtime Botox treatment, a more invasive procedure like a facelift, what are you holding there? Cosmetic surgery is a booming industry that's only getting
Isn't this that thing you
bigger.
do when you're like stressed out and you
I don't think so.
Coming up, we're going to talk to a plastic surgeon about the 4 hottest trends in plastic surgery for 2008. Silicone or saline?
Go deep.
Love this. Feel that. Yeah.
An autopsy done on Kanye West's mother cannot pinpoint the exact cause of her death. Donda West died in November, one day after undergoing a breast reduction, tummy tuck, and liposuction. The Los Angeles County Coroner's Office says heart disease and plastic surgery could have played a role in her death, but the exact contribution of each factor could not be determined. Jan?
Thank you, Mike. Dr. Greg Wiener is a plastic surgeon, and in just a minute, we'll be talking about the top 5 trends in cosmetic surgery. But first, let's talk about Donda West and the risks of plastic surgery. Earlier reports stated that she'd gone somewhere first. The plastic surgeon would not operate on her and went to someone else.
Right.
How common is that?
Well, the key thing here is that she did go to a board-certified plastic surgeon first, and she had some medical problems. He understood those problems, and he wanted her to get clearance from an internist. And the problem is that she didn't do that, and she went to somebody who would not do that, and he did the surgery without the clearance. And she obviously needed some testing before she went under this procedure.
Yeah, she was on our show. You can see well, we had the video earlier. She was on our show, and I interviewed her. And she seemed very healthy to me.
Right.
Is it the plastic surgeon's job, though, to get that internist to give the clearance?
Yes, in a sense it is. It's the plastic surgeon's job to make sure that his patient or her patient is prepared correctly for surgery. So if there's any hint of any problems, an abnormal lab test, an EKG that looks strange, anything, then they've got to follow that up and either get clearance from an internist or make sure that they do the appropriate testing to make sure that that patient is adequately prepared.
Okay. Certainly plastic surgery is just booming right now. It's a tremendously a huge business. And we want to talk about some of the top trends. First of all, breast implants. It's a big deal these days, especially that silicone has come back into the market. You have some examples here of silicone and saline.
Yeah.
Clearly the silicone I've felt them earlier, feels a lot more real.
Oh, absolutely. The silicone in my right hand here is softer. It's a lot more natural feeling, and this is the saline, which is what we've had to use for the last 15 years. Since the silicone came back on the market about a year ago, after it was FDA approved, it's jumped up big time. About 30% of my breast augmentations in my practice are silicone gels, and I expect that to rise.
Do you trust silicone?
Yes, I do. My wife has silicone gel implants, and she's breastfeeding right now, and so I do trust the technology, absolutely.
Yeah, and you did your wife's breast implants.
Yes, I did.
So you're obviously a believer in that. Non-invasive wrinkle erasers, I hear that's a big one with men and women.
Right. The less invasive procedures have skyrocketed, up 400%, over 400% since '97, and it's just amazing. The problem is some of these less invasive procedures don't work as well. What we have here today is profractional, which is a laser treatment that actually will spread out wrinkles, fill in wrinkles, and does it with very little downtime. Traditional laser procedures can take as much as 2 weeks to recover from. This is about 2 or 3 days.
We have a before and after picture right now, certainly a dramatic difference. How long does this last?
This is permanent. This is permanent.
Yep. So her face on the right will be that way.
Absolutely. I mean, of course, the aging process will continue, but the results are permanent. Yeah.
Ultrasonic liposuction, something we're hearing a lot about these days. I understand men. This is a really big big operation with men.
It's the #1 procedure nationwide for men is any type of liposuction. Now, ultrasonic in particular is great because men have love handles, and it's very tough. It's kind of tougher to get those reduced sometimes. The ultrasonic is very effective in reducing that, low downtime, several days, and minimal bruising and swelling.
Yeah, what does that mean, ultrasonic? Exactly, what is the procedure entail?
The ultrasonic cannula actually, through a small incision, goes underneath and actually liquefies the fat. So the fat is liquefied, and you get smoother results, and you can actually remove more fat that way.
Okay, and finally, the mid-facelift. What is this?
The mid-facelift has been a reaction to people wanting more focused procedures, and the mid-facelift is kind of like a supercharged eyelid lift. And
look at the before and after pictures here. That is dramatic.
What we're doing here is lifting the entire cheek along with the eyelid, so it's quite dramatic. And the downtime again is probably about 5 to 7 days for something like this.
Wow. And that's where you're cutting around the face?
No, that's an incision that's right under the eyelid, so it's completely hideable.
My goodness. Well, thank you so much for coming in. We'll have more on all these plastic surgery trends on our
Thank you very
website at
much.
myfoxchicago.com. We appreciate it.
Thanks, Jan.
Mike, back to you.